Constantly appearing new outbreaks. Should China live with COVID-19? Some experts believe that, from the fact that the epidemic can break out at any time, China should relax strict epidemic prevention measures, learn to live with COVID-19, change its goal from reducing the number of new cases to a decrease in the number of severe cases and deaths. Delta variant threatens China's no-COVID strategy. The COVID-19 pandemic had been under control in China for months, until a new outbreak was discovered at the airport in Nanjing. Less than 3 weeks later, the outbreak had spread to at least 17 Chinese provinces. The epidemic situation is more serious when many infections Delta variant and outbreaks appear in the right tourist season. Although the number of COVID-19 cases remains low, recording about 700 cases since July 20 until now, health officials remain on high alert, seeing this as the biggest challenge since the pandemic. Outbreak in Wuhan City. Chinese Vice Premier Sun Xuanlan told officials on August 4 that the top priority was to prevent the spread of the Delta variant. The epidemic situation is still unstable and there will be a nationwide inspection of pandemic control in places like hospitals and clinics. The Delta variant is posing a challenge to China's no-COVID strategy, as authorities try to keep the number of cases to a minimum by isolating new arrivals, testing extensively, contact tracing, lockdowns, travel restrictions and more. The no-COVID strategy is also applied by some countries such as Australia and New Zealand. With the rapid spread of Delta, which is now the dominant variant in many countries, the question is whether the no-COVID strategy is really a long-term solution in China. The latest outbreak has also dashed hopes of China's border opening in the near future as many cities undergo extensive testing, traffic is disrupted and many hotspots are locked down. The U.S. Centers for Disease Control and Prevention, CDC, describes the Delta variant as more contagious than the common cold and flu, and even spreading as quickly as chickenpox. Stuart Turville, an associate professor at the Kirby Institute at the University of New South Wales, said that the SARS-CoV-2 virus is increasingly adapting to its ability to bind and combine with cells, causing infection. It looks like the Delta variant is spreading faster than it actually is, Mr. Turville said. He Qinghua, an official with China's National Health Commission, said that the rapid, strict, and large-scale measures that helped China contain more than 30 previous outbreaks will continue to be effective with the latest outbreak. However, epidemiologists say the rapid spread of the Delta variant will pose a challenge with these measures. The incubation period of the Delta variant has been shortened by at least 1 day. Do you have enough contact tracing time if you only have 3 days instead of 5? That's going to be a lot harder, said George Rutherford, a professor of epidemiology at the University of California. Should China live with COVID-19? Some public health experts are questioning whether it's time to ease China's strict pandemic control measures and learn to live with COVID-19. In Shanghai, Zhang Wenhong, head of the infectious disease department at Huashan Hospital, said the latest outbreak shows that the risk of COVID-19 will always exist, and the challenge is how to live together with epidemics for a long time. That's something other countries are starting to do, and China can learn from, said Nicholas Thomas, an associate professor of health security at the City University of Hong Kong. Other countries, by choice or by circumstance, are finding ways to live with the pandemic. While this measure may lead to a higher COVID-19 death rate, it will help restore the economy more quickly. In fact, this may be China's only option because the pandemic has now spread globally, Thomas said. Mr. Thomas said that China cannot easily overcome COVID-19 when the world is also trying to recover from the pandemic. Despite the effective lockdown, its costs are increasing with the loss of opportunity. Over the next 6 to 12 months, unless a worrying variant emerges, those costs will be unsustainable for China. Some countries are choosing not to minimize the number of new cases, but to try to reduce the number of severe cases and deaths. Singapore is one of them. In June, Singapore switched from a case-free policy to treating COVID-19 as an endemic disease like the flu or chickenpox. Britain, one of the countries with the highest COVID-19 death rate in the world, eased most restrictions, including the one on wearing masks in mid-July, despite an increase in the number of cases. Breakthrough at that time. Around 73% of adults in the UK are fully immunized. In the week from August 2 to 7, the country recorded more than 188,000 new COVID-19 cases, but the number of deaths was relatively low with 627 cases. The goal is to reduce deaths and hospitalizations, which I believe vaccines do, said Rutherford. To achieve this, we will have to accept an increase in the number of cases. The Delta variant makes planning more difficult, but we're trying to cope through lower-level interventions like wearing masks, said Rutherford. New Zealand epidemiologist Michael Baker, a professor of public health at the University of Otago, said that countries relax control measures after achieving relatively high vaccination rates, such as the UK, US and Israel. And EU countries have seen a sharp increase in the number of cases, but the vaccine has been highly effective in preventing hospitalizations and deaths. From a public health perspective, it would be reckless to allow transmission of the virus before a country has achieved a high vaccination rate. Even then, it is important to maintain public health measures to prevent infection. All of these countries have good health infrastructure and capacity, which helps to reduce the impact of the increase in the number of cases, Baker said. Mr. Baker also noted that the Delta variant has added pressure to disease control efforts and delayed reopening plans that are being made in countries and regions, despite an increasing number of people. More vaccinations. Australia has said it will consider opening its borders when 80% of adults are fully immunized. New Zealand is questioning whether and how to reopen its borders this week. There are some people, myself included, who think we don't necessarily need to learn to live with COVID-19 until we know more about the long-term effects of the virus on human health, he said. Mr. Baker said. In China, Feng Zijian, president of the China Association of Preventive Medicine, said that the country would need to maintain tight control measures at the border until it reaches a high vaccination rate. According to the Chinese CDC, about 1.77 billion doses of the vaccine had been administered as of August 7 in this country of 1.4 billion people. China will have to make a decision on how to adjust control measures as more people are vaccinated, Feng said. However, Mr. Feng also noted that it is difficult to assess the impact of mass vaccination because the number of new COVID-19 cases in China is currently quite low.